that's also good to know. All right, so our topic today is the impact of COVID on food security, and in particular, the impact on Latino households. And here at MANA, we are seeing firsthand the impact of COVID on food security based on an increase in phone requests for food assistance and the number of food packages our logistics staff is creating and distributing, and all of the deliveries that we've been making. As a point of reference, let me share this. In February, we served a total of 2,968 households. And that number started to climb every month since then. And so in July, we served 4,290 households. That's an increase of 44%. So we've seen that grow over the past 5 months. Before COVID, Black and Latino households were already disproportionately represented in our service numbers when compared to their total number of households in the county. Both communities we were seeing at 16% higher in our service numbers than are present in the community. After the pandemic started, we began to see a large increase in new households that had never received food from us before, particularly in the Latino community. We started looking at statistics every week. And so every week since early March, we have seen an average of 4 times as many new households calling as we received in the first week of March. Consistently, 63% of those new households have identified as Latino. And when we look at the total households served, Latino households have increased from 35% of our service numbers to a total high of 51%. The last couple of months have evened out at 47%. So through Breaking Bread, we try to explore new solutions to the experience of food insecurity. And these increases that we're seeing are so significant that we thought it was important to look specifically at this part of our community and explore other ways that Latino residents might be impacted by COVID, because we know that food security doesn't happen by itself, and the solution is broader than just providing food. We know that our experience as a service provider is not unique because of the groups that our staff is involved in, and everyone is experiencing increases in requests. And a few weeks ago, the Montgomery County Council approved a special appropriation of over $5 million to provide a strategic, culturally competent, community-focused approach to public health to help contain the spread of COVID-19 in the areas of Montgomery County that have been hardest hit by the virus. The funds are for a new agency that will provide wraparound services, including COVID-19 testing, health resources, and public education targeted to Latino residents in the county. So today we invited 2 experts to share with us what they are seeing in their fields and to help support this conversation. First, we have Dr. Kenneth Fader, who is a CDC disease detective assigned to the Maryland Department of Health. There he works on outbreak investigations and emerging disease threats. In addition to his work in Maryland, he completed a 6-week deployment to Ethiopia, supporting the Global Polio Eradication Initiative. Dr. Fader completed his PhD at Johns Hopkins Bloomberg School of Public Health in 2019. And we were fortunate that he literally showed up on our doorstep with a few of his colleagues who wanted to survey some of our program participants. So we're happy to have him today. And then next we'll have Carmen Castro-Conroy, who is a HUD-certified bilingual housing counselor and manager of the Montgomery County Office of Housing Initiative Partnership. Carmen has more than 20 years of experience working for nonprofit housing agencies, and she's a passionate advocate of affordable housing issues in our county. So we'll start with Dr. Fader, and then we will ask Ms. Castro-Conroy to share with us after he completes his sharing.
Okay, thank you. Thank you for inviting me, Angela, and thank you to everybody for joining. It's a pleasure to be here. So as was said, my name is Kenny Fader, and I am CDC, a permanent assignee to Maryland Department of Health, which means I work for the CDC, but essentially I work full time for the Maryland Department of Health. During the month of July, for most of the month of July, I was reassigned by CDC to come do a special project in Montgomery and Prince George's County. And that's what I'm going to talk to you about today. And specifically, that was me and a couple of colleagues who came down from the CDC all over the country, were requested to come for a special deployment to investigate the causes of elevated incidence of COVID-19 in the Latino community in Montgomery and Prince George's counties. And so what I'm going to talk about today is what it is that we found. And with a really, I apologize, my computer is freezing up, so I'm having trouble pulling up the presentation. Just a moment. What I'm going to talk about today is sort of what we found, and I think it's going to be a little bit different than what some others have said because the focus will be less on COVID's effect on food insecurity and more on the effect of all the things that are happening in the community on COVID-19, right? So the charge of our deployment is really to say, what's going on here with COVID-19 and what could potentially be done about it. And so that's really where I'm going to focus the bulk of my talk. And this is the same sort of preliminary outbrief that we gave to the county health department when we left. So I apologize, right at that moment, Microsoft PowerPoint decided to crash. So if you'll just give me a moment to get this pulled up, I will share my screen and we will start in just a second. My apologies for the delay.
No problem. Technology is outside of our control, apparently.
Okay, can others see my presentation?
Yeah.
Okay, I see a lot of nodding heads. That's good. Let's see if we can switch to slideshow mode. Okay, very good. All right, so like I said, I'm going to talk about COVID-19 in Hispanic Latino communities in Montgomery and Prince George's counties and discuss the preliminary findings of our investigation, which went on for about 3 weeks. So just for some context, we received our request to deploy in early July. For 3 days we came and we mostly just spent time talking to county health officials and community members to try to get a situation of the lay of the land. I was a little bit more familiar since I'm permanently assigned to Maryland, but my colleagues are not. And then from July 11th to July 26th, we really engaged in 3 activities. So what we did was we really tried to sort of take a multifaceted approach to accomplishing our deployment objectives, right? So our goals were first to identify the disparities that existed. So to say, okay, is there a difference in the incidence of COVID-19 in the Latino community in these 2 counties as compared to other counties? And if so, how big is it, okay? Second, try to say, okay, if it's there, why does it exist, okay? And what are the causes of it, and what are the barriers that drive barriers to things that we think are important for stopping the incidence of COVID-19, like social distancing, use of masks, isolation, participation in contact tracing, all these things that you've heard about that I'm going to talk more about. And then finally, what more could be done, if anything, to address these disparities or any disparities that we identify. And when I originally wrote this presentation, it was a 45-minute presentation, so you'll see me skipping through slides, but I'm gonna dive right into talking about the first of the three things that we did. So what we did was three things. So the first is we did a secondary analysis of the existing surveillance data that's collected by the County Departments of Health and by the Maryland Department of Health. And using this data, we tried to say, okay, based on the data you've already collected, what can we see about, the disparities that exist and what are their causes. Second thing we said is, okay, so but maybe there's some gaps in these data. So what we're going to do is we're going to do a community survey. So we're going to go to sites that serve the Latino community in Montgomery and Prince George's County. We did this both at testing sites and at food distribution sites, which is how we were introduced to MANA, is that my colleagues came and you kindly permitted us to survey people who were participating in the food distribution program there about their experiences with COVID-19. And then the third thing that we did is we partnered with some community organizations like CASA and the Langley Park Civic Association to conduct 3 focus groups with members of the community to really dive in detail about what their experiences with COVID-19 were and what more they felt they needed to protect themselves and their families from the virus. So I'm just going to walk through briefly what we found in each of those 3 parts of our investigation: the secondary data analysis, the survey that we conducted in the community, and then the focus groups that we conducted with a smaller number of members of the community. Okay, so the first part, the epidemiologic profile. So what did we find? So our goals here were, first, quantify the disparity in COVID-19 incidents, comparing Hispanic Latino residents to non-Hispanic Latino residents in different race ethnic groups, trying to understand what are the hospitalization and death outcomes of people who get COVID-19. So we're not just interested in if you get COVID-19, we're interested in what happens if you get COVID-19. Does this differ between racial and ethnic groups? Third, we're going to look at neighborhood characteristics. We're going to try to understand what are the characteristics of neighborhoods where Latino residents of the county predominantly live, and how is this potentially affecting their risk for COVID-19 as opposed to other neighborhoods. And the fourth thing we did is we dove in and we looked at a little bit of data from the state's contact tracing program, which at the time we started was just getting off the ground. It's a lot more robust now, and try to understand how well is the contact tracing program serving members of the Latino community in the 2 counties. And I'll talk a little bit more about how contact tracing works when I get to that. Okay, so for this, we used surveillance data that's collected by the state of Maryland. So as some of you may be aware, COVID-19 is a reportable disease. So what that means is that every laboratory that does testing for COVID-19 is required to report their test results, positive or negative, to the state of Maryland and to the local county health department. And so so we can conduct a public health investigation and try to act on that lab result to prevent further spread of the disease. And this is a common practice. It's what we do for other things like tuberculosis or measles or other diseases that are of public health concern. And if you get it, it's of concern to others. And so we used the master database of all cases of COVID-19 that have occurred in Montgomery and Prince George's County since the start of the pandemic. And of those, about 66% had valid information on race or ethnicity. And we were able to say, okay, we think this person is likely Latino. We think this person is likely not Latino. And those 66% of records were used for the main analysis. And then for the neighborhood level analysis, there were 90% of the records that had a valid address. And so we also used those 90% of records that had a valid address for the neighborhood level analysis. We also used data from the contact tracing program, which is basically, we looked at the people who were, attempted to be interviewed by the contact tracing program since it came online in April. And finally, we used data from the US Census to learn a little bit more about the communities people were living in. So this figure shows just a sort of summary of, background of how things stood when we took over it and the deployment in July. Okay, so what this shows is on the right-hand side of the screen is the weekly numbers, and on the left-hand side of the screen is the cumulative numbers. So we'll focus on the weekly numbers, okay, is the number of cases of COVID-19 per 1,000 residents in persons of known race ethnicity, right? So the actual rates were higher because there were some people we excluded because we didn't know the race ethnicity, comparing Latino residents to people in other racial and ethnic groups. And so we can see here just how dramatically higher the incidence of COVID-19 was among Hispanic and Latino residents of the 2 counties, and it ranged between 3 times higher to 10 times higher, depending on what race ethnic groups we were comparing residents to. And what's interesting is that, as you can see, and as I think you're probably aware, cases peaked in, here it's showing it by what's MMWR week, but that's basically the week of the year, so the 20th week of the year, so in March or April, and then declined dramatically into July, but the disparities persisted. So in other words, cases were higher, and then they went way down, but at whatever level of cases existed, we're seeing 3 times or more cases each week among Latino residents than we are among non-Latino residents. And this is based on laboratory test results. We're seeing 3 or more times new positive test results among Latino residents than among non-Latino residents, okay? So the next thing we did is we dove in and we said, okay, so we see that in the county, Hispanic and Latino residents are at much higher risk for contracting COVID-19. Once they get COVID-19, does it appear that they're at risk for worse outcomes? And at least based on our preliminary data analysis, we didn't find that was the case. In other words, when we looked at hospitalization and death among people who actually contracted COVID-19 and accounted for differences in age and sex, which is important because Latino residents of Montgomery County are much younger on average than other residents of Montgomery County, we found that Hispanic and Latino residents were not any more likely to be hospitalized or to die from COVID-19 if they got it. In other words, the disparities are primarily seem to be driven by increased risk for contracting the virus, not worse outcomes once people have contracted the virus. Okay, so what this map shows is a side-by-side that I think you as residents and people already doing service in the community will be familiar with, but I think it helps highlight the point succinctly. So on the right side of your screen, what you see is Montgomery County census tracts shaded by the proportion of residents who are Hispanic or Latino. And the left side, what you see is Montgomery County census tracts shaded by the number of COVID-19 cases per 1,000 residents in the census tract. And so what we can see is that there's almost perfect, not perfect, but that there's essentially complete overlap between these two maps. And so this isn't just about individuals contracting COVID-19. What we can see is that, as you're aware, Hispanic and Latino residents are often de facto concentrated or segregated in a small number of neighborhoods in the county, and it's these neighborhoods that are experiencing the highest rates of COVID-19 by far in the 2 counties, or were in April through July. Okay, so what's going on here? Well, so what are some of the factors that could explain elevated COVID-19 incidence in these counties? So based on what we, what we heard from key informants, so our interviews with the Department of Health, they identified a number of factors that they thought were contributing, and we looked to see just how overrepresented, these factors are in the counties with high incidence, right? So the things that kept coming up and over again, right, are number 1, crowded housing conditions. Number 2, occupational risks. I'm going to talk a little bit about what that means because it's actually a little bit different than what we expected coming in. Number 3, immigration-related barriers to services. And number 4, lack of access to healthcare, okay? And so what we can see is that some of proxy measures from the US Census, that in neighborhoods in the county that have the most Latino residents, they're also much more likely to be experiencing higher rates of these risk factors. In other words, they have many more foreign-born residents who are likely to be maybe struggling with immigration-related challenges, including possibly, impeding access to public benefits. Much higher proportions of residents who are uninsured, again, possibly another proxy measure for immigration-related barriers to public benefits, but also directly affecting access to healthcare. Many more workers working in 3 of the 5 sort of US Census occupational categories that we might be more concerned about. So resource extraction, construction, and maintenance, service work, and transportation, production, and movement of goods. We see many more people working in those sectors in predominantly Hispanic and Latino census tract as compared to tracts which have many fewer Hispanic and Latino residents, and much more crowding, so many more households with more than 1 occupant per room. And so what we see, I won't dive into the technical details that much, but essentially we did what's called a regression analysis, which is we try to look at all these factors together. And we say, are these characteristics associated with elevated COVID-19 incidence? And so what you can see here is, if you're familiar with regression analysis, but I'll try to summarize it in plain English, is that basically counties where these risk factors are more common, where more people are working in these occupations, where more people are foreign-born, where more people are do not have health insurance, have much higher incidence rates of COVID-19. And after we adjust for those characteristics, it explains away some of the elevated rates of COVID-19 in neighborhoods that have the most Hispanic and Latino residents. In other words, we think at least part of the reason we're seeing higher rates of COVID-19 in Hispanic and predominantly Hispanic and Latino neighborhoods is because those neighborhoods are also struggling with crowded housing conditions, with occupations that may put them at greater risk for contracting COVID-19, and with lack of access to public benefits and particularly public health insurance. Okay, so let's take a look at the state contact tracing program. So just for some context, the way the state contact tracing program works is that if you test positive for COVID-19, any contact information we have about you is passed to the state contact tracing program, which is a centralized contact tracing program. In other words, the first attempt is made by a subcontractor run by the state of Maryland. And then if they have trouble reaching you or there's something tricky about your case, they pass it to the county health department to try it a little bit harder to reach you, okay? So what we saw when we looked at people from the first month of contact tracing data is that people who we knew were Hispanic or Latino, who were attempted to be interviewed by the contact tracing program, were least likely to actually respond. In other words, they were least likely to be successfully interviewed and reached by a contact tracer. But then among people who were actually interviewed, people who spoke Spanish during their interview, because there's a bilingual option, reported more contacts. In other words, there were more people who were potentially exposed to them. And that was primarily driven by household contacts. So there's more evidence that people may be disenfranchised by participating in the systems that are designed to protect them. And then also some evidence that people are, if they contract COVID-19 in the Latino community, are maybe at greater risk of spreading it to others because of crowding within their household. Okay, so summary of the key points: more likely to contract COVID-19 if you're Latino living in the county, but after accounting for age and sex, it's not clear that there's any evidence that people are at higher risk for worse outcomes for COVID-19. In other words, once you have COVID-19, you're not any more likely to be hospitalized or die if you're Latino. Latino residents who contract COVID-19 tend to be younger than other residents who contract COVID-19. Children make up an unusually large share of cases. I didn't mention that before, but that's important. I'll come back to it. Latinos may be less likely to be successfully interviewed by a contact tracer. And our data analysis suggests that crowding, occupational risk, lack of access to benefits, and other immigration-related factors may be primary drivers of these disparities. So now let me talk about the survey, and this was the survey that was done in part at your programs, right? So what we did is we approached about 100 people who are participating in either food distribution programs or public testing sites for COVID-19, try to learn about their demographics, whether they've had trouble accessing testing for COVID-19 in the past, if they were trying to get testing, why they got testing, social stressors, how COVID-19 has affected their lives, whether they have good knowledge, whether they have good information about COVID-19, and where they get their information about COVID-19, to try to understand how we could improve our outreach. So, and we did this at a number of different sites throughout both Montgomery and Prince George's counties. So what do we see? Okay, so we talked to 102 participants. I'm gonna focus for this presentation, because these are preliminary results, only people at food distribution sites, and only people who were primarily, who identified as Latino. So we interviewed some non-Latinos too for comparison, but I'm not gonna present that data. Okay, so who did we talk to? So people were mostly recent immigrants from El Salvador and Guatemala. They're primarily young and female and working in vulnerable settings, okay? So what we saw is that 3/4 of our respondents were female, 3 out of 5 were under 50. 2/3 said they spoke English a little or not at all. 1/4 worked as cleaners or housekeepers. So this was by far and away the dominant occupation. More than half live in dwellings with more than 2 occupants per room. So clearly experiencing crowding in the home. And then 1 in 5 are living with 3 or more children under 10 in their home. So many children living in the home, a common theme. Okay. So another thing that we see that came through right away is that people are taking strong measures to try to protect themselves from COVID-19. They're extremely concerned. So of the 102 people that we interviewed at food distribution sites, 100% of them said they always wear a mask outside their home. And all but one said they always wear a mask when they're at work. But 1 in 5 said their colleagues or their clients may not always wear a mask. So in other words, there's strong support for mask wearing, and they're wearing masks to protect themselves, but not everybody around them is necessarily wearing masks. We asked about barriers to healthcare. And what we saw is that, cost was primarily the #1 barrier to healthcare, but transportation and not knowing where to go were concerns. And then we asked folks if they had wanted testing in the past but couldn't find it, and about 1 in 5 said yes. And for those who said yes, we tried to figure out why, and they named a number of factors, including inconvenient hours was probably the biggest one, transportation, not knowing where to go. People also named cost, which was interesting because testing is free. So it suggests there's some misinformation, or that people were relying on old information and don't know about new testing resources that are available. We asked why people should be tested for COVID-19. So we wanted to understand if people know when it's appropriate to be tested for COVID-19. Most people said you should be tested when you're symptomatic. And then a significant number of other people just said you should be tested all the time out of an abundance of caution. It's spreading in the community. Just go get tested whenever you can. But fewer people said they should be tested when they were exposed. So those people know they should be tested for COVID-19 when they're sick, but they don't necessarily know they should go ahead and get COVID-19 testing preemptively if they think they might have been exposed to the virus. And then finally, and this was important to the county, where are people getting their information about COVID-19? So the #1 place people got information about COVID-19, informal sources. So my neighbor, my friend, the community, my family. #2 source was television, and then the other main sources people cited were phone and WhatsApp. So also similarly informal sources. So a lot of the way people are getting their information about COVID-19, for those of us doing outreach, and it's important to understand, is through these informal community networks. They're testing each other, they're messaging each other WhatsApp, they're reaching out to their neighbors, and that's how we're going to get information to them about the things that they may be available to them or to help protect them from COVID. Okay, so what I'm going to talk about now is the focus groups. I think this is probably the most interesting aspect of what we did. So this is a picture of the focus groups being led. Some of you may know George Escobar from CASA, who graciously offered to facilitate one of the focus groups for us. He was fantastic. We had some colleagues who facilitated the other two. They actually zoomed in from Puerto Rico so that we could do all of the focus groups entirely in Spanish. So that was really fantastic. And so this is here at the CASA site doing the focus group. So, okay, so this was to dive in and try to get a deeper sense of what are people's experiences and what do people think needs to be done about it. And so we did a standardized interview. The sessions took 60 to 90 minutes. There were 6 to 10 participants per group. And I'm just going to present some preliminary key themes that emerged. Okay, and we focused on specific topics. Okay, so personal experiences, whether people are trying to protect themselves by wearing masks and whether they're able to do so, whether people are trying to protect themselves by social distancing, whether they're able to do so, whether people have access to testing. So when should you get testing? How do you get testing? Have you been tested? How did that work for you? Healthcare and treatment. So if you needed healthcare, could you get it and would you get it? Isolation and quarantine. So if you needed to isolate because you had COVID-19, could you do so? Would you do so? If you were exposed, would you quarantine? Could you do so? Would you do so? Contact tracing. Would you participate in contact tracing if you were contacted? And a number of other topics that I'm not going to touch on in this talk because they were specific to piloting the county's communication materials. Okay, so let's dive right into the findings. Okay, so what were the personal experiences people had? So the #1 thing that emerged is that by far and away, the biggest concern in the community wasn't necessarily contracting the virus. It was the economic and financial impact that the virus has had on the community. So this has been enormously distressing. People have lost jobs, people have lost income. As you've said, people are having trouble feeding their family. People are immediately concerned about their ability to pay rent. I didn't say this in the survey because, but 4 of 5 participants said they were afraid they weren't going to be able to feed their family, weren't going to be able to afford rent. And, those were folks in a food distribution program, so we know they're struggling, but I think that's important context. We also see enormous psychological and emotional trauma, depression, a lot of fear, a sense of loss and not being able to touch or hug loved ones. And I do think it's important to come back to this notion of trauma. This came up again and again. People really emphasize, here's a quote. So truly it has been a tremendous change because people are living in fear. It's affected work and emotional aspects of life. There's a lot of depression because the community has lost family members. You see a lot of people around who've lost work and because they're sick. People are living in apartments, there's transmission in apartments. Over and over again, we heard this has been a traumatic experience for the community. There's a tremendous stigma associated with COVID, and that because everything has closed, traditional community centers, particularly schools, are closed down. And so this has really fractured ties and support networks in the community. In addition to feeling scared, people are feeling isolated. And this robs them of the support network they might usually turn to protect them through a traumatic experience like this. So diving into sort of what needs to be done to prevent the virus, so we asked about social distancing. So most people know the social distancing guidelines, and they believe it's really important, and they try to do it. And we also observed this, that during the focus groups, everybody adhered strictly to the social distancing guidelines. But they said that it's difficult to socially distance in restaurants or food stores, particularly crowded living spaces, at food drives and charities. So they're concerned to some extent about crowding while attending food drives or charities. Exercising or walking past people. I think there was more concern about distancing outdoors than maybe we would have been concerned about, knowing that transmission risk is much less outdoors. But in general, you know, there's concern. People want to distance, but they're concerned about situations where they can't do it. There's also frustration that other people aren't social distancing, right? So they say, I went out, I go to the store, I go to the restaurants, I see people there. You know, what a shame that the government can't do more because people are very close to each other. We also asked about mask wearing. So there's excellent compliance with mask wearing. Everybody says they wear masks. Many people have received masks from the county and they're very grateful for that. People typically say that wearing a mask is required for their work and to ride on public transit, which they wear. Children were cited as a challenge, right? So they said children can't wear masks or have trouble wearing the masks. They have trouble keeping them on their faces. And so they're concerned about people not wearing their masks correctly. Initially said there were problems accessing masks, issues like price gouging, but now they said masks are pretty available, but they are still concerned. They definitely want more concerns about people wearing soiled masks, difficulty finding affordable masks, and people sharing masks so that they can go participate in food distribution sites because the masks are required. So we asked about testing. So most focus was on you know, where did you get testing? I want to skip ahead because I'm running short on time and I want to. Well, okay, so this is not on the slides, but I want to actually touch on this because I think this is a really important point. So we asked about when people thought they should be tested, and people basically said if you're symptomatic or exposed to COVID-19. But there are also people who explicitly stated they were concerned about being tested and avoided being tested, even though they were symptomatic or exposed to COVID-19. And basically they said, well, I'm afraid I'll be ordered to stay home from work because if I don't work, I won't be able to feed my family. And they also said, I'm afraid I'll go to the hospital. And this was a consistent theme that people were very scared of the hospital. They have experiences being mistreated in the hospital in their home countries. They don't want to go to the hospital. They say the food quality is poor. They're afraid of being away from their family and having no one to take care of their kids. And they are afraid of dying alone, which is a legitimate fear, unfortunately. There was also some outdated information. People thought you needed to pay for testing when it's available for free in the community. I'll skip media consumption. So healthcare, you know, consistent theme is that people are uninsured. They say they can't afford healthcare. A lot of them rely on home remedies like medicinal herbs. They say they turn to churches or social networks for support. Major feelers of going to the hospital, which I already talked about. Isolation and quarantine. So this is another one that I think is important. So all participants understood the isolation guidelines. And they said if they tested positive, they would try to isolate. But then some of them admitted they know the guidelines, but they wouldn't follow them because they need to work. And they would go to work, even if they were sick, because they would otherwise not be able to support their families and pay rent. And they also stated that they would not only fear risk losing employment, but that they risked stigma. In other words, if people knew they were staying home, they risked being discriminated against and being discriminated against because they had COVID-19. And they also feared, I didn't put this here, but they said they wouldn't have anybody to take care of their children. So they said we wouldn't be able to isolate because our children would be around. Contact tracing. So we asked, would people participate in contact tracing? Most people had never heard of contact tracing. Once we explained it to them, most people were amenable because they saw the value, but if they said they hadn't had it explained to them in the focus groups, they would have been less amenable to the contact tracing, and they're afraid of particularly of the stigma or fear that might be associated with being identified as somebody who had COVID-19. So I'm going to skip the communications review section because this was just about seeing whether the county's communications materials were effective, and jump to the key themes. Okay, so what are the key themes we found? Okay, so community members want to social distance, to isolate while they're sick, and to protect themselves from COVID-19. But they struggle to do so because they face skewed incentives and information gaps. Okay, so work might require them to be exposed to unsafe conditions. Economic consequences of missing work might be too severe to stay home. There might be too much crowding at home to isolate. Children require care that can't be provided while isolating. Members may avoid testing to avoid stay-at-home orders. Testing might conflict with work hours or other demands. People might not go get tested just because they have to get work when the testing sites are open. People may falsely believe that symptoms and money are required for testing. And members may fear disclosing their contact information to contact tracers because of discrimination. So mostly I want to have a conversation, hear what you all think, because I think we're really here to learn because you're more familiar with the community than we are, and I'm happy to discuss any things. But in terms of what are the solutions, I think the key theme is trying to counteract these underlying factors that create perverse incentives and prevent people from being able to protect themselves, right? So can we provide care packages, food, medicine, personal protective equipment when people get sick so that they won't have an economic incentive to avoid testing and isolation? Can we promote out-of-home isolation, like in hotels, so that people are able to stay away from their families when they have COVID-19? Expand testing accessibility on nights and weekends. Enhanced workforce protections might be needed. And I think, you know, one thing that came clear to us is we clearly saw that occupations were a risk factor in the data analysis. And what we took away from the focus groups was that it may be less that people are necessarily exposed to COVID-19 at work, and more that if they have COVID-19, they're concerned they'll be fired or discriminated against if they don't work. So they continue to work in unsafe conditions. So it's not necessarily that they're necessarily being exposed in unsafe conditions at work, it's that they're forced to continue to work sick, thus potentially exposing others at work. Continue distributing masks. So masks are extremely supported and they're well used. And then a real need for focus groups, counseling, support groups, partnership with community organizations to help reduce stigma and the mental health challenges. And then equally important as offering these services is getting the word out. And in particular, and I think this was a key theme, is that the one community center that really has not broken down at all is food distribution. So food distribution has become extremely central to the most vulnerable communities because many people are participating in it. There are Spanish language services there. It's free and people know it and they trust it, and it's done through churches and other organizations like yours that are trusted. And so this is one of the best opportunities to disseminate information about COVID-19. In other words, when you're getting your food, you also have a chance to get other things that can help keep you safe from COVID-19. And then this sort of is less relevant to your program, but another important place is we really would like the contact tracing program to potentially do more to inform people about the benefits they may be eligible for if they get COVID-19. And that's a technical issue that has to do with the state doing the contact tracing, but the county providing the benefits. So that's something we're going to potentially look into going forward. So that was everything I want to say. I know I went extremely fast and I apologize for that, but I hope this was informative and that there was some things that were new here. And I will stop. Thank you all for listening. I'm looking forward to hearing the next presentation.
Thank you so much. This is really great information for us. And as we know from what you shared, housing is an important factor. So we're interested to hear what Carmen can share with us about the housing issue.
Thank you, Angela. And thank you for the invitation to present to this group today. I'll try to cover as much as I can with the time I have. So let me go ahead and start sharing the screen. Can you all see the PowerPoint?
We can see it.
So we want to talk about the impact of COVID-19 on tenants, renters in Montgomery County. So let me introduce myself. My name is Carmen Castro Conroy. I'm a certified housing counselor with Housing Initiative Partnership. We're not new to Montgomery County. You haven't heard from us. We came to Montgomery County in 2009 as a result of the foreclosure crisis. And I've been with HIP ever since. It's a great organization. We provide a number of services, all free of charge as a nonprofit. We're HUD approved, so all of our staff is bilingual in English and Spanish. And we do foreclosure prevention counseling, rental counseling, post-purchase, pre-purchase, financial capability, and credit counseling. Today, I'm going to talk about some of the what I would call pre-existing housing conditions in Montgomery County that would definitely put you in the right sort of the facts that we're definitely hearing from in regards to the impact of COVID on the Hispanic population, Latinos. So basically, in Montgomery County, population of a little over 1 million, we have about 200,000 residents who live below self-sufficiency standards. These are not the federal poverty guidelines. These are slightly higher for Montgomery County, basically families that wouldn't need any type of support or federal benefits to be self-sufficient. So that's a large population in our county. 24.5% of households in Montgomery County are considered without liquid assets. And that's basically families who do not have enough savings to cover 3 months of expenses. And those are the recommended guidelines for emergency savings. We have about 49.5% of renters who are house burdened. That means renters that pay more than 30% of their income towards rent. And we see a lot of those families, about 50%. Many times not just over 30%, but over 50%, over 70, 80% of income that's going to pay for housing. 60.4% of seniors are considered house burden, especially those who only rely on Social Security income. Large portion of their income goes towards rent payments. Next, I wanted to cover some of the statistics in regards to race and poverty demographics in Montgomery County. So for the percentage of residents that live below the self-sufficiency standard, we see that the majority, over 50%, are Hispanic, followed by Black or African American, Asian, and white. Housing burden is the next area that we see again. A large percentage Hispanic, over 60%, 50% Black or African American, followed by white and Asian. Now, in regards to voucher recipient, this is the Section 8 Housing Choice Voucher. We have the largest percentage, almost 70% African American, a little over 20% white, about 11% Hispanic, and again, it's about 4% Asian. Next. So in regards to housing assistance, there are about 7,000 current housing choice vouchers available in Montgomery County, when the waiting list is over 30,000. So again, 7,400 housing vouchers, 30,000 families in the waiting list. Similar to that, the emergency rental assistance wait list has 3,000 people when there are currently about 1,400 rental assistance families that currently benefit from it. So you can see the large percentage of people that are waiting for this type of subsidy. The housing choice voucher is a federal money that goes towards to alleviate the high cost of housing by allowing families that are of low income to only pay 30% of their income towards rent. The difference is paid by the voucher. So we also have an affordability crisis in the country, but especially in our county, where we can see that the fair market rent for a 2-bedroom apartment is currently at $1,700 a month. With the current minimum wage of $14 an hour, the affordable rent would have to be no more than $728. So that explains why so many families live in overcrowding conditions, because at minimum wage, they wouldn't be able to afford a 2-bedroom apartment. So the affordable rent at minimum wage is $728. For an Social Security disability recipient, and that's usually a check of about $750 a month, that affordable rent would have to be $235. And we know that someone with that kind of income wouldn't even be able to afford a room rental. So these are all pre-existing housing conditions that make a pandemic much more difficult to deal with. Now I want to talk about some of the initiatives at different levels, federal level, state level, and county level, that have been in place to alleviate some of the concerns, especially the economic impact. So at the federal level, there was a moratorium on evictions that expired on July 24th. That moratorium was only in place to protect properties that were covered by federal loans, FHA, Fannie Mae, Freddie Mac. It hasn't been extended, so the moratorium has expired. Then we also heard about the CARES Act and the economic impact payments that were many families were eligible for based on their tax returns of 2018 and 2018. Many families received checks in the amounts of $1,200 to $2,400. And this economic impact payment was only granted to US citizens or US resident aliens. It's still available for anyone that may qualify. They have until October 15th to sign up if they haven't received. This is a one-time stimulus check. The other program that was in place that was very helpful was the federal pandemic unemployment compensation. That was an additional $600 a week in federal unemployment benefits to all those eligible for unemployment. Everyone had to apply for the state benefit to be eligible for the federal benefit. So it wasn't necessarily a separate application, but everyone had to go through the state system. That additional compensation also expired in July, at the end of July 2020. It hasn't been extended. So at state level, we are currently still under a state of emergency that was declared on March 16 by Governor Hogan. And the Maryland courts have been ordered to prohibit evictions of any tenants. And this is very important because these are evictions of tenants who can demonstrate that their inability to pay rent is a result of COVID-19. So we're still under this order as long as we're still under the state of emergency. So this is a message that we're trying very hard to get out. We still see evictions of those who whose court orders were filed prior to March 16. So if you hear of any families being evicted, most likely those evictions started prior to March 16. We're also currently under a prohibition of termination of utility services that was also governor's order. That unfortunately expires on September 1st. There is no word of any extension. This order has been extended 2 or 3 times already, but it would be devastating for many families to lose services. And the utilities protected under this prohibition included electricity, gas, water, sewage, phone, cable, TV, and internet. In addition, no late charge could be charged during this period. So the Maryland courts are on phase 3 of their reopening schedule that started July 20th. So they're currently, the courts are currently taking new filings or court orders for eviction that started July 25th. Hearings will be for eviction will be scheduled after August 31st. And the courts will resume full operations after October 5th. So that's exactly where we are. We haven't seen cases where clients have had to go to their hearings, but we're expecting that those numbers will start and will be very high as after August 31st. Now, the state of Maryland has designated money towards the couple of programs. One through the HCA, the Department of Housing and Community Development, for housing relief program to specific properties within the state where renters could get some relief. And the other one is money to be distributed to all counties throughout the state for emergency rental assistance. So what programs do we currently have in Montgomery County? On April 24th, the county council basically announced a program called Renters Relief Act, where a limited increase in rent during the pandemic to no more than 2.6%. The city of Tacoma Park, they have their own rent control, and the cities of Rockville and Gates were adopted the county guidelines. Now, currently there is a program that just opened yesterday through HOC. It's the COVID-19 Rental Assistance Program. They will take applications through August 31st. This program will help households who are at least 1 month behind in their rent. It will be a partial assistance of $600 a month for 3 months. So we're trying to get the word out to all of our clients about applying for this program. It's only open to permanent residents with legal status or citizens. The other program is through the Montgomery County Department of Health and Human Services, the $20 million program that was announced a few weeks ago. The funds will be available starting late July or beginning of September. To apply for this program, families have to call the 311 number. We also provide assistance with applications for the HOC program, and we work with families who are behind on their rent to tell them about what programs they may be eligible for. So this affirmative defense during eviction is very important, because if the families get a court notice for eviction, they will get a court date. If they go to court and show the judge that their failure to pay rent was a direct result of COVID-19, the eviction will stay. If they do not go to court, the eviction will move forward. So it's very important to tell, everyone that is worried about the rent, that's behind in rent and paying rent, about this affirmative defense. If they get a court notice, they have to go to court, and we can provide that assistance to those families who may have a case to present before the judge. So through our program of rental counseling, we assist tenants who are facing eviction. We provide them with information about programs that are available to them based on their circumstances and help them apply for those programs. We also educate tenants about the whole eviction process and their rights as tenants, and answer questions about their leases and any type of exchange they had with their landlords. We can also help tenants negotiate payment plans with their landlords, and worst case scenario, if for some reason they get evicted, we can also help them move into transitional housing or find alternative housing. That's my presentation, how to connect with HIP. This is our number, 301-916-5946 is our intake number. We answer that number Monday through Fridays from 9 to 5. All of our services are free of charge. All of our counselors are bilingual in English and Spanish. And all of our services are currently being provided remotely over the phone. And we provide assistance, like I said, to applications, referrals to other programs. We refer many families to Mana Food, and Mana Food has been great with the families that we serve. So right now I will stop share and see if anybody has any questions.
Okay, thank you so much, both of you. This has been really incredible information. I have to say that I am feeling a bit more stressed than I was before this conversation started. Just, you know, the realities, having more details. Wow. So we technically have 20 minutes left. I'm sure people have questions. Let's take a few questions, and then we want to talk about what's possible. What can we do? So would you please raise your hand if you have a question, and then we'll try to go in order. And apologies for the background noise here. It's a busy time in the warehouse.
Angela, I want to take a minute. I need to bring my cable. I'll be right back.
Sure. Mm-hmm. All right. Does anybody have a question, or would you like to share some initial reflections about the information that we've heard? Yes, Mary.
I have a question for anyone. Does anyone have an idea of what's going to, what we're going to face when the moratorium on the evictions is gone? Because like they still owe all that money, right? I mean, it's not wiped out. So what's going to happen to everyone who owes that much rent?
Sure. So right now, if the landlord has the right to file for eviction by law. And that was okay after July 25th, or under phase 3 of the reopening. Now, the tenant also has the right to go to court. And if the tenant is able to show that their loss of income was related to COVID-19, the eviction will not take place until the state of emergency ends.
Right, that's what I'm asking. When it ends, what happens?
The landlord will be able to move forward and schedule an eviction with the sheriff if the tenant doesn't pay what's owed, or if they both don't agree to some kind of payment plan. So we're hoping that those tenants will be able to apply for rental assistance through the county to cover some of the rent they owe, if not all of it, that the landlords will be willing to work with those tenants on paying whatever money they owe through a payment plan. But we also fear that some landlords may not be willing to work with tenants, and tenants eventually will be evicted. So that's why we're very concerned about what's going to happen in the next few months in regards to evictions. And a lot of people are talking about an eviction tsunami coming up.
Right.
Yes, please go ahead.
Thank you so much for all the information. Many of the families and students that I work with, they are undocumented, and they don't have money, and many of them are on the fringe of being homeless. That's why 20 of them live in a 3-bedroom apartment because they can't afford, and then they get the COVID because they're, so it's like a vicious cycle that is happening. At what point can we jump in to assist them with this finance? I mean, I help them with everything. The only thing I can't help them with is money. I can help them with food, cleaning solution, clothing, shampoos, all that. How can we help these undocumented families that are behind? I also have families whose parents have died. The lease is under their family. They are not undocumented, but the landlord is kicking them out because they are telling them the lease is under the family, the parents, even though they have been paying the rents on time. So, I mean, can you deal with things like that in your organization for our Latinos?
Yes, and we serve everyone, all ethnic groups, races, demographics. We don't look at incomes when they come to our office. And that's part of the work we do, like advocate on behalf of tenants. So we reach out directly to landlords and see if we can negotiate. When I talk to clients, I ask them how long they lived in that apartment. Sometimes I hear that tenants have been in the same place for 5 years, 10 years. So I expect that those landlords will have some flexibility. And especially if they have a good record, that they've been good tenants, that they paid on time. So we're gonna do a lot of negotiating coming up. But what's important right now is to tell those families to contact us if they're already behind the rent, and if they already got some letters from the landlords or some court notices, because they shouldn't miss their hearings. So they will have additional time to work through the programs that will become available. And the program through Montgomery County, the most recent one that's gonna start in a couple of weeks, anyone can apply, regardless of legal status.
And just to add I think you talked about where do you intervene in a vicious cycle. So it's extremely difficult. And I think that I want to acknowledge up front that, speaking from the perspective of a public health agency, right, like we're limited in our capacity only, and our charge is to focus on preventing the illness, right? So similarly with the capacity to address any underlying economic or social risk factors that I just talked about substantially during the presentation that you're seeing in your clients limited. I think that, with COVID, the focus, so the most important things that we do to prevent COVID-19 are that first step of preventive measures, right? And that's what people have the most trouble with in this community because of the conditions that they are living and working in. The flip side of that is that mask adherence is extremely high, right? So masking is a clear point of intervention when that's available to people. Higher quality masks, better masks, more masks, so that people are able to protect themselves using masks, even when they can't protect themselves using distancing. But beyond that, I really think that the key point of intervention, other than, greater facilitation of anything that can be done to allow people to distance or mask more, is when you find that index case, what can you do to protect everybody who's around that person, right? So that's a real point of intervention. And what I think that our investigation the county shows is that it's a multifaceted approach, right? That when somebody tests positive for COVID-19, simply instructing them to isolate and stay away from their families and others is probably insufficient, right? And so even if you can't provide long-term economic assistance in a way that's necessary to address some of these underlying causes, you can provide short-term assistance to address some of those underlying issues that exacerbate the highest risk events for transmission. And that means facilitating opportunities for people to isolate outside their home, providing personal protective equipment so that if people are remaining in their home, the people who are caring for them in their home have masks and face shields or goggles, gloves, whatever else. Providing food and temporary assistance so that people are not going hungry or their kids aren't going hungry during the time when they're missing work. You know, measures like that help protect people, not only help protect people by meeting those immediate needs, it also reduces the risk, I suspect, or could reduce the risk that they'll do things that we know spread the virus. In other words, we know how COVID spreads by having close contact with other people. So the more you can empower people to not do that, that's a point of intervention.
I'm sorry, I just have to, this is a great occasion for me to ask these questions. So I have been able for last 2 months get free masks, handmade masks, you know, through a lot of different organizations. So I have been going to the lunch site, to food sites, to the families I know in the neighborhoods that I know they are high in, you know, people who don't have it. So I have distributed over 700 masks for the last 2 months. But is there a way that these PPE measures can also be supplied free of charge to people like me that are in touch, you know, with these families? I mean, I get them from organizations that are donating them to me, but they are handmade masks. Are there other revenues that, you know, that we can get these to these families other than just?
Sure, it's a great question. So from the public side, the answer is probably no. And the reason is basically because there's a priority scheme for personal protective equipment, and there are continuing global shortages in the United States. So, right, so what that means is that the state has personal protective equipment, and then first line goes to healthcare providers, second line goes to healthcare support professionals, like people who are providing direct care, then to first responders and so on, and general members of the community who are just at high risk because they live in a neighborhood that has high rates of transmission are going to, as far as I know, aren't on the eligibility list. So that's unfortunate. But the second answer is through private foundations potentially, right? So Angela can correct me if I'm wrong, but one thing that our group did is that we facilitated a partnership with CDC Foundation, and I believe they are providing 12,000 masks to MANA. Is that right, or something like that?
That is correct, yes.
Yeah, 12,000 masks to MANA to distribute as part of the food distribution program. And I hope that's the start of a partnership. In other words, we can start there, but continuing to look at that as a resource. And CDC Foundation is a private foundation that's partly publicly funded, partly privately funded, that has flexibility to fund initiatives that might be otherwise limited in ways that the CDC can't fund them. And so that is a good opportunity if you're taking measures, you know, if you're integrated into the community and you're a good vehicle for distributing masks where they see incidence is high, that's a good place to go for something like this. And they have masks that are mass produced, so they're made up to a certain standard of quality, presumably also. So that's an option.
There is a question in the chat from Taryn Shaw. Do you want to share this, Taryn? Taryn asked, is an analysis currently taking place that assesses the impact of evictions on landlords? I do not see it working in their favor. Maybe a possible education campaign showing losses they'll incur from vacancies can deter them from evicting current occupants.
So we have had some meetings with property managers and landlords to advocate on behalf of tenants through different groups, one of them Action in Montgomery and Catholic Charities as well. They have seen an increase in their default rates from what was normally under 5%, like 2 or 3% of tenants not paying rent to up to 20% currently of tenants not paying rent. So what we're also trying to find out is like out of those property managers, if they are getting any type of relief from the federal government, depending on the type of loans they have on these properties. Some may. Same thing with private lenders. We know that on the mortgage side, for property owners, some of them have had some forbearance, which is like suspension of mortgage payments for up to 1 year. So that should equal to, with some relief for tenants as well. So we're constantly working with like tenant organizations, reaching out to landlords to advocate on behalf of tenants as much as we can throughout the state.
Thank you. So we have just a couple of minutes left, and we always try to respect everybody's time. We usually end our session by giving people an opportunity to make a commitment for an action that they might take over the next 30 days to explore a new topic that is related to what we're discussing or food insecurity in some way. I might ask both of our guest speakers what you might suggest are steps. And we've talked about some, and I know that a lot of us represent organizations, but some of us are, you know, thinking about what we can do as individuals. And is there something that you might suggest that could have a big impact that we could take on as individuals to make a positive difference?
We definitely want to work with all agencies that have direct contact with families that receive services to get the word out about the programs that are available now and prepare them for what may come in the next few weeks or months. So that at least they'll have the resources available that they actually need now. Our agency is fully trained to like, and we are actually expanding and we're currently working with Department of Housing and Community Affairs and a few other agencies in trying to respond to that anticipated demand from a lot of families that are currently in this situation. Right now, we are just hearing from them on their fears of what's going to happen because they owe, many of them, more than 1, 2, 3 months of rent. And the assistance is going to be limited. So partnering with organizations that have the trust of the families that are served and trying to get that information out. So we have flyers in English and Spanish, and the Department of Housing can also provide you with lots of flyers that you can give to the families when they pick up their food items or get deliveries. I think that campaign of educating and informing will be very helpful.
Thank you. Dr. Fader, is there anything that you can suggest?
Sure, I'm gonna take two tacks. One is the personal route, so how we conduct ourselves in our personal lives and what we can do, and then the second is the organizational sort of applied route. So the first is I think that it never can be overstated the extent to which we have the capacity to lead by example when it comes to COVID-19, right? And that basically means practicing physical distancing and mask wearing in our own lives, even in situations where it is unpleasant to do so. And I think in particular, we see people who feel that one is a substitute for the other, but they're mutually beneficial. I mean, the evidence is pretty clear that each of them together helps reduce risk of COVID-19. And so collectively, both are necessary to prevent transmission of COVID-19. And so continuing to model mask wearing wherever you go, whenever you're seen in public, is a great opportunity to show others that you and members of the community are taking measures to protect others, even if it's a situation where that wearing may not be strictly necessary to protect yourself. And then similarly, continuing to physically distance, even in settings where other people may not be doing so, right, is a way to both keep yourself safe and by keeping yourself safe, keep other people safe. So you're protecting your community around you and model positive behavior. So I really do think that the more individuals demonstrate those behaviors, the effects grow exponentially in the same way that the virus spreads exponentially. And so it's a tremendous benefit. Now, in terms from an organizational perspective, I really think it's continuing to constantly think about ways to partner with other community organizations that are really ingrained in immigrant communities. I mean, you know, we saw that while the deployment was focused on Latino residents, most of our work was focused on recent Central American immigrants, because that's where the incidence was, and also with the county health department, to think about how the programs you're working in can be targeted to people who get COVID. In other words, when somebody has COVID or when somebody's had COVID, can the system of community organizations that may be able to serve some of these people who the government, for one reason or another, cannot swoop in and fill some of that gap, so that in that moment of crisis, people are able to be served by trusted organizations that have fewer constraints on their actions, to prevent them from transmitting the virus. In other words, to meet their basic needs, but also to, you know, protect the people around them by doing so. So every opportunity that exists to do so, and to partner with public organizations that obviously we all want to do the same thing. We want to stop transmission of this virus. You know, that public-private partnership is going to be really, really key, and we're going to need your help in this community. So thank you. By the way, I should say that. Thank you for everything that you're doing and your organizations are doing.
Thank you. Thank you both. This has been so incredible. I really appreciate the information that you both shared with us. I think we've, you know, much more educated about what's happening and how we can be involved. And I'm very grateful for your time. There was a question earlier about whether or not you could both share your presentations. And so if so, please do, and we can make it available to everyone who participated. And we will also be making the video available for people who weren't here today. So thank you so much, everyone, for joining us. We do this every month on the third Wednesday. And so our next meeting will be on September 16th. I hope that you can join us.